really?
It's not easy.
Well, this is one that says, please, I'm following the program this morning. I have a few questions for Madam. First, what's the way forward for nursing training, payment of allowance, recruitment, and the continuous growing of backlogs of nurses waiting for employment? I think you answered that. There's a second, are there any plans cutting the numbers of new students, nurses, or even stopping regular admissions for a period to make room for those backlogs to be cleared? Take note of that there. Third, are there any new innovations in the training nurses which could be targeted based on needs assessment about the areas of needs and looking into apprenticeship mode, which will cut the cost of regular admissions associated with allowance? I'm happy to, says happy to discuss the area of apprenticeship implementation, though I believe Madam is more knowledgeable in the health area. Interesting, Prof. Will listen to you, even if you're talking about health, which he knows better. Anyway, but I think the part that he raises a point is whether there are a number of new student nurses for cutting the number of new student nurses.
Okay, so it's a very interesting question because it has gone back and forth.
Okay.
I think that nowadays we give each school gets a specific number on how much they should hire because again, like the backlog. But at the same time, we cannot stop training nurses because what if somebody has finished school today and they want to go to nursing? You understand?
Okay.
So what we are trying to do is any new nursing institution must actually any new one. Like that is non-existent that is coming into existence must actually perhaps be a specialized training center, not the general everyday. So because remember, like I said, we need specialists. And luckily for me, my minister has put me in charge of the nursing training institutions.
Okay.
So what we are looking at now is that any new nursing, it has to be a specialized because we need a specialist.
Okay.
The generalists, we have plenty. Some of them are sitting at home. So even the generalists at home, we need to bring some of them into specialist training. That will also decrease. While we are hiring some to help with the free primary health care, we need some to help with the Mahama cares.
Okay.
Because remember, those are the specialized cares. So we will slowly cut the backlog and put some of them up there as specialists, super specialists, nephrology, endocrinology, critical care, emergency medicine, and all those specialists. Whilst we are hiring the people for the generalized care to help with the free primary health care, the community nurses, we're even having community volunteers.
Okay.
You know, YEA has already trained some health assistant volunteers.
Okay.
My constituency, we had about 50 people go total. They've already been trained.
Okay.
So those are the people that we use. Some of them can start as community health assistants.
Okay.
You understand? Whilst we're bringing in the community health nurses, we're driving the demand. The demand will definitely go up. Again, if we are able to, our communication is driving the demand, then we can have, that means that we need more hands.
Okay.
That is when we can slowly get rid. But I think that slowly, we will get rid of that backlog and then we'll be on track. Because if we can also stop training. If your child finishes school today and says she wants to go to nursing training, can you say there's too many nurses so we can't train you? No, you can't do that. You understand? So the goal is to clear as much of the backlog while we continue to train. And maybe, I don't know what the final decisions will be, but we are still also using evidence-based to really make decisions. We don't make decisions arbitrary. So we look at the needs assessment, we look at what is on the ground, we look at how many people are being trained today, and then we make evidence-based decisions based on our observations. So, and also, of course, wide stakeholders engagement, because remember that the nurses have their associations, they have the Nurses and Midwifery Council, we have the schools, we have all that. And even last week, we brought all the principals of all the nursing training institutions, we have 90-something, to one place. And we spent 3 days. And the idea is to streamline everything so that nurse A from this school is not different. The training is not different from nurse B.
Is that what you find happens?
Sometimes, because of that, it's not completely streamlined. So we have now brought on board a roadmap
Okay.
where all of us are on the same page.
Okay.
And we want every principal to know every principal.
Mm.
You know, we want the organogram to be the same here as the organogram in school B. So the more we can standardize things, the more we can get the quality of nurses at every different level that we need.
Well, to conclude, this is, I'm sure you know Dr. Nana Iyofie.
Yes.
Okay.
Oh, Lord.
He says, okay, so this is the story. I'll read a portion for you to respond. The Ghanaian Point is publishing this one. It says, according to him, key features of the new program, including the use of Ghana card, access and eligibility criteria similar to earlier initiatives rolled out under the MPP administration. He argued that the structure of the program closely reflects previous health interventions and questioned what new value the current policy brings beyond rebranding. Dr. Efriye further maintained that elements of the initiative, including references to annual health checks and universal access systems, have already been implemented in various forms in the past, insisting that the proper credit should be given where due. Says the minority has therefore called for clearer differentiations of new policy innovations from existing frameworks.
Senna, thank you. See, this is the same issue that came up the last time I said I was somewhere else.
Yeah.
So I would have expected that since he's saying this, he'll come up with evidence, right?
Okay.
So you are making your case. Okay. So you can say that because of our program, we trained this number of people. Those people are here. They are doing this. The program that we set up, these are what we got out of it. This is all rumors and innuendo, respectfully. You understand? He hasn't given us any evidence.
Okay, so you haven't heard in terms of which programs specifically
thank you.
referring
So
to?
give me the evidence.
Okay.
And they're contradicting themselves. They said the program won't work. Even the tricycles is now ambulance. So we don't want it. And at the same time, they are taking credit for it. I think the job of an MP who is defending this is one of the most difficult because they are confusing me. I sat here and explained exactly what we are doing. So if you're coming in and you are giving news reports or you are doing your press conference, tell us what is the evidence, right? Because by now, quote unquote, your program would have run for 8 years at least, or we're in the 9th year of your program.
Yes.
Where is the evidence?
Okay. So they should show you a program they've implemented that resembles. That's exactly what you're doing now.
But that is what a proper debate, that is what a proper discussion is about. I sat here and told you that we are trying to reach universal health coverage in 2030. I'm telling you that we are opening 150. I'm telling you the number of equipment we've bought. I've explained to you the Mahama Cares, the Ghana Medical Trust Fund, and the free primary health care. I have done all this with evidence. And now you are saying, where is this evidence? And in any case, we are here today and we are doing free primary health care. So, Dr. Yu, please get on board. Let us make sure that we are helping Ghanaians, that we are saving Ghanaian lives. This matter is a health issue. Health issue is neither MPP nor NDC. The last place you need your party card, I'm a surgeon. I sit in consultation rooms and I'm also a surgeon specialist. So my own is after you have gone everywhere and your case, like that super specialist, is when they come to me. And by the time they come to me...
if you can't help me, I can't be helped.
What do you mean?
Okay. You say you are at the top.
Yes, I'm
so
saying
if I
in
come
terms
to
of
you
the
and you
referral...
say you can't help me, that's all.
In terms of the referral pattern.
Okay.
So in terms of health and health referral. So after the doctors have seen you and your case is like really advanced. So I'm in that Mahama Cares critical care group, right? In terms of physicians.
Okay.
So after they come to us and we can't do anything, then what do? So this Ayu thing and this story that he's telling, me, I'm so confused. They are confusing us. They say they don't like the program. It won't work. Ambulance cry, we don't need. Apobo yapo there is ambulance. Oh Lord, these people now they have taken photos side by side. Abobo ya, how can Abobo ya and ambulance be the same? But we're not even talking about that their bad history. Their agenda 111 that they didn't build up to today. There's not one functioning, operational one hospital that they built for Agenda 111. That the La General Hospital was a hospital, even though it wasn't maybe a modern hospital, was a hospital that people in the La area were going to. You demolished it and didn't even put one brick. At one point, they were growing cassava on the plant on the land. And now that we have implementing our program, at least as a medical doctor, get on board. His patients will benefit too.
Prof, thank you.
I bet you he's even looking for Mahama cares for some of his own patients too. I bet you he's going to his chief compound to see if we have brought the much needed equipment. Doctor, you call me. We'll see what we can do in his chief's compound. So all Ghanaians, regardless of who is the MP in your constituency, whether you are NDC or MPP, all Ghanaians will benefit. President Mahama wants Ghanaians to benefit.
Okay.
And he's testing us to ensure that this program is implemented well to the benefit of all Ghanaians, regardless of political affiliations. So they should stop this thing. It is getting too much, and they are now exposing themselves because every single step of the way they are confusing us.
Okay.
Is the thing good or not good? If it is good, how do we move forward? If it is good, come and join us and let's do it better. If you have better ideas or you want to add to it, because we came to you in Parliament and we told you. So if you had some input, you could have brought it and would have included it.
Okay.
Half of them haven't even read the policy document. So
Prof,
if you ask them what is on page 2, they don't know. But they are against. So some people they are against. So no matter what media I'm against. If it's good, I'm against because I'm MPP. Please, Dr. Yu, let us help you so that you as a physician can help your own patients to acquire the better health care that all Ghanaians deserve. Health care is not a privilege. It is a human right. And that is what we are bringing so that all Ghanaians, regardless of where you live, regardless of your income status, regardless whether you are rich or poor or in the middle, can access good quality healthcare at the primary level of our health system, the health system that is closest to the people so that people will have better preventative and promotive healthcare.
Prof, thank you. Thank you. Professor Grace Ayensu Danquah is Deputy Minister of Health. Like he told you.
Hi, Dr. Yu.
Like she told you, she's at that level where when they tell you that this is your problem, we can't solve it, you're going. So
I'm a surgeon specialist, so they'll bring you to me when it's a little bit far gone.
Yes.
But most of the time, we can do something about it.
Okay.
So we don't say you are going.
This is Nicholas Aguda, who works within the health system in the UK, says that the decongestion of health facilities at the top alone is a huge relief for the patient and the healthcare practitioner. The free primary healthcare is indeed a game changer. Thank you, Professor Ayensu Danquah, for the education and information. I will recommend the routine checks and maintenance of the equipment, especially the tricycles and motorbikes at designated places for prolonged lifespan and efficiency.
Yes.
Well, we will see you tomorrow with another edition of the Gold Morning Conversation. We are happy you passed through in the morning. She has a boyfriend in the afternoon. Every time they are talking, she never comes in the morning because of the boyfriend in the afternoon. Well, he will be on at 1 p.m.
He's coming, Ransford. How are you?
He's already here. He will be on at 1 p.m. with Pampa. So do make a date with him. But today, we have our friend DJ Abega. When I came to the Gold Newsroom, one of the people I met in the Gold Newsroom was DJ Abega. He uses 2 different names. When he's playing music, he's DJ Abega. When he was in the newsroom, he was Daniel Badu. So it depends on where you find him. This morning, he will be DJ Abega. You know him. You know him well. He's taking over the mid-morning show. Stay tuned.